Very excited to have Dr. Amitava Datta with us. So, Dr. Amitava Datta has been on the Ketospan protocol starting July of 2025. So, it's almost 8 months, about approximately 8 months. That's Dr. Amitava Datta has been. And he's been one of the very consistent users of Ketospan, very, very methodological in terms of recording and tracking. And when Dr. Amitava Datta started, there were many ailments, including elevated blood glucose levels, elevated blood pressure levels, and many other aspects of health that Dr. Amitava Datta was dealing with. And he was also on many medications, but he himself will share his journey on what was his experience through Ketospan and how he got about disease remission or reversal in many circumstances. So, Dr. Amitav, welcome to the show and welcome to be on Ketospan. We would like to welcome you and let you share your own journey as to how your life journey has brought you to Ketospan. So, please feel free to share in your own words your entire life journey.
Thank you, Anish. Pleasure to talk to you as always. And also thanks for enlightening me in this specific area of improving my health as well. As you mentioned that you would like to hear a little bit about my journey specifically to my health so far. And in terms of this, as I look at it, is for the last probably 4 decades, I would say, that I have been possibly going to doctors on different occasions. And it started from probably issues with my gut, then probably with my knee and arthritic pains, I would call it, because it was how I believed from the doctors that these were the problems that I had. And subsequently, blood pressure. Then going on, was told that I have glaucoma, and then ultimately, gradually, I believed that I have diabetes type 2 as well. So while I understood many of these phenomenon, but probably I looked at each of them in isolation. And each of them, I tried to tackle or try to look at it from specific, area of tackling them, and of course, with different type of medications, which were very pointed by different doctors on these ailments, or rather, I would say that this sort of these that I would call it, which I acquired during my lifestyle and my journey in terms of what I have been living through. So, in a nutshell, I would say that many of these things I have, acquired during probably the way that I have lived my life, or rather, I was forced to live my life because of my work pressure, which had effects on this. And that's how I finally, before I started talking to you, and we have been talking to this on this for quite some time, but I had, a bunch of pills that I used to carry with me, uh, probably, and I had a dedicated drawer full of medicines, which I had to supplement on a monthly or a bi-monthly basis to make sure that I'm not running out of medicines. So that was, in a nutshell, how my journey has been, specifically in terms of my health. I don't know whether you want to know or get into any details of any of this, but I will leave it to you how you
So
want to understand this a bit more.
I think it would be interesting for because when we got in touch in June about this issue and before you started with Ketospan, other than medications, were you already aware that lifestyle or diet or these can have an impact? And did you try any other either a program or just by yourself any other interventions, lifestyle interventions to address these issues?
So I was familiar with different type of diets, including ketogenic diets, but I had not applied my mind and gone through it in details. That's number one. I was familiar with, that I need to balance my work life as well as my health life on things starting from physical exercises, going to the gym. And during the course of my last four decades, I have been into different gyms. I have been to yoga. I have been doing multiple things, and which of course have given me relief, but they were very, short-lived in terms of the relief. And when I say short-lived, specifically, it was one of the things that we normally see is our weight, for example. But then it so happened that my BMI uh, went into an obese state, going up to 33, 34, which was, of course, alarming. But then, uh, 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 while I was conscious about many of these things, I had not put myself into a rigor, and rather, I would say that I was not completely motivated in terms of what I should do to get these things under control. That's
Right. And you mentioned quite a lot of list, and also I think probably you didn't mention, but sleep apnea and stomach acidity. Those were also some ailments that were bothering you, if I'm correct.
Yeah, yeah, you're absolutely right. So one was acidity, of course. And again, I say that in terms of I had regular visits. I had to have regular visits to my gastroenterologist. That was one. Of course, I had to also go, as you mentioned, that 15 years back, rather I would say 20 years back, I was also diagnosed with sleep apnea, and I was using a CPAP machine. And once in a while, I had to also go and consult my the doctor in terms of how I was doing in terms of my sleep apnea as well. So
Right,
those were added stuff
right.
in terms of the other things that I have been trying to take care of as well.
And in terms of your day-to-day lifestyle, what was it affecting in terms of clinical symptoms? For instance, were you having body ache, headaches, or brain fogs, or in terms of clinical symptoms that were bothering you the most?
So of course, my energy levels were low. That was one thing. I had to push myself in terms of getting things done. That was one. Second, I had disruptive sleep, I would say. Second was um, I could not work too much on the computer because I could feel that my eyes were strained. Um, and then, of course, beside this, um, intermittently every 3, 4 months, I had to take medicine specifically for my gut and for my indigestion and problems. So these were in addition to the normal things that I had to do, and of course the typical symptoms of diabetes which were there, um, which I don't want to say everybody's familiar with them. That's one. Um, and of course, besides that, I also suddenly found out that I'm very particular in terms of making sure that every 6 months I do a proper consultation with the doctor, do make sure that all my biomarkers are right. But then I found that my triglycerides shot up. I found out my uric acid shot up. So these were also things that started, and of course, in between, for the last many, probably a few decades, I had always, I was told that I had a fatty liver as well.
Right. Right. So now let's come to the point where in July you started with Ketospan, and I remember having explained to you the concepts, and you were someone who is really curious. You are an academic, you are a doctor yourself, a PhD doctor. So, but you are very curious about knowing more. So, can you share a little bit about when the journey started and I started sharing with you more knowledge, more information about metabolic health and the various nuances and how you have to change your diet? What was your first initial reaction? Did you have any hesitancy, or did you have any concerns, and how did you start off with that journey?
So I will take a step back, Anish, because I have known you for a couple of years. And of course, whenever we used to meet, I used to get more educated in terms of how you have managed yourself, the things that you have gone through. And of course, I had a lot of curiosity on this, and I kept myself abreast in terms of some of the things, what was happening. However, probably uh, health was not on top of my priority. And of course, this was fundamentally because of there were other things which I had to put my attention on. And then when we met again in July, we spent the evening together. I mean, both of us sat down, we talked about this a bit, and then I felt that I need to put myself into a proper regime if I really was keen to prioritize my health, number one, and then get into something which I believe I should have been focusing on earlier. So the first question it came to me was, when you talk about health, what is the definition of health to you? Because every one of us have our own definition of health. And at the stage of my life where I am, I came to two specific things that would be my focus on. Number one was, when I say I want to have a healthy life, it means to me that I should not be having any medication. If I am having any medication, that means I'm not healthy. Unless and until that this medication is needed because of certain things which probably are acquired because of uh, what I would say from a aspect of my lineage or hereditary aspect that I acquired and which cannot be solved at this point of time, or probably there are still more research needs to be done. That was one. The second aspect was that uh, I would like to have a better, or rather, I would say a much more productive life going forward, both at a cognitive level as well as a physical level. And if I would like both of them to be support me in terms of the things that I still feel that I need to do or accomplish, uh, then it is important that I need to focus on this. And that's where I started this journey. in probably you gave me the motivation to believe that there is a possibility and I could probably get rid of all my medicines. And that's where I started putting, or rather planning and implementing and following a protocol that I, uh, you know, took up again, discussing with you, taking your guidance and seeing how this can be done. And to me, that has become my lifestyle now. I'm still on the journey, but I think so far in the last 6 months, what I have accomplished, I think it is, for me, I could have never thought of.
Great. That's amazing. It's amazing. And can you please elaborate on what specific symptoms or diseases did you start seeing going in remission, and how has the journey been over the last 6 months?
Okay. So today, if I say, and I'm not at this point of telling what did I do, but today, as the outcome that I see is that whatever medicines my doctor had prescribed me, whether it was blood sugar, blood pressure, triglyceride, uric acid, thyroid, or supplements, D3, B12, etc., uh, the doctor has asked me to stop everything because from the tests that I have done, and I'm saying this uh, last probably November. That's when I started in July end, and then by November I was out of all the medicines. And then again I did tests in end of mid January. In January, uh, I mean my biomarkers are very very positive in terms of how things have been going, and I'm much more confident today in terms of what I have accomplished. But then there are many more things that I probably have to also find solutions to as well.
Yeah, you mentioned getting rid of many of the medicines, but also I would like to add here that even the most obvious biomarker, which is the weight, which you had a very drastic reduction in. So from 92 kilos, you went, I think you are in 79 kilos currently. Is that right?
78. I'm now 78.
Amazing. And along with that, optimal blood glucose levels, optimal triglyceride levels. But how about the complaints that you initially mentioned in terms of energy levels and your arthritis pains and those are the clinical symptoms?
So to me today, most of the things are gone because I didn't realize that many of these were related to my inflammation levels. So my inflammatory markers have significantly gone down. So that's one. My energy levels are, I would say, much more than what I actually imagined. My productivity has improved. In fact, I go for Pilates regularly every week, multiple times, and the amount of, or rather, the type of workouts that I used to do with Pilates today, I'm doing at a much more higher level that I was doing earlier. And of course, it has, it is because of number one, I have lost weight. Number one, I have lost a huge amount of visceral fat, which is also helping me doing many other physical activities, which probably I couldn't have done in my Pilates sessions. So those are much more. In fact, um, I can now simply climb 5 stairs without even feeling exhausted. When I say 5 stairs, I mean 5 floors.
Incredible.
So I keep my benchmark like that, that if I can walk up, how am I feeling?
Great. Uh, so I think your journey is really inspiring, but I have a question about the sustainability of the diet and lifestyle itself. Because for many, the question is that maybe the type of diets that you need to do in order to get this reversal is very restrictive or it's very difficult to adhere. How has been your journey in terms of adherence, and also does is life much more boring with this restriction or not?
So, in terms of the diet, um, today I am on a what we call it as a OMED, 1 meal a day. Now it has not happened overnight, so it was a journey. So gradually, it took me 2 months, 2.5 months rather, to get into a OMED diet. Um and then on top of it, I also have been following uh, a full day fasting as well. These are the two things which actually helped me get my or reset my biomarkers rather. Now today, I am still on a 1 meal a day, and every week I have not been doing a 1 day fasting because of other reasons. It's more the day that I normally do, which I tend to do something or the other happens. I have guests, I have to go out and meet guests. So it becomes a little bit difficult in terms of socializing. But it is not of a concern because I have not seen by not doing a 1 day per week fasting, my weight has increased. I have, I have tried to restrict myself in terms of my diet, make sure that I'm not able to going overboard with my carbohydrate intakes, and that's how I intend to take it forward. Or going forward, how I would like to make it as part of my lifestyle. And initially, it was a little bit of a difficult for me because uh, making my diet, protein centric, I did not know what is it that I should be eating, what I should not be eating. But I knew that I had to reduce my carbohydrate, and how do I balance this out? So today I am much more confident in terms of what I should eat and how I can, improvise on my diet. So uh, I don't think so. It's much difficult at all. And just to also emphasize this is that while I live in Lisbon, um, I always felt that in Portugal it was not a big deal in terms of uh, making your diet or improving your diet to the way that you really want to do. And then I felt that I was in India for a month. I felt that it would be difficult for me. And this time when I went there, I actually could set my diet at home the way that I felt I wanted to do, or which was apt for the way that I had been following up in Lisbon. And after 1 month stay in India, when I came back, I had in fact 1 kilo less of weight than what I had going to India, which was for me an aberration because every time for the last 8 to 9 years that I have been going to India every year, I used to always come back with 2 to 3 kilos extra.
Very interesting. So, just one final question or some thoughts I want you to have. So, now that you have experienced through, you know it's possible for humankind to actually get rid of most of the chronic disease as long as there is a will from the patient, as long as they are ready to make some sort of a change in their lifestyle. But where do you think are the biggest barriers, and what do you think going forward is the potential of this kind of an approach?
So, uh, as I say, most of us have been hard coded to the fact that we need to follow whatever the doctor tells us to say or tells us that we need to be doing. Or rather, I could say that prescribing the medicines, telling us this you should do, this you should not do. But then I felt and I realized as I went deeper into this is that I have not come across a doctor who has told me what I should do to get out of my medicines. Most of the doctors have been, I go and the expectation is that he or she would be prescribing me a set of medication to take care of my problems. I never have been to a doctor to telling me what to do and not take medicines. That's the first set of, or rather that's the mindset that we all have. The second aspect is that even what the doctor prescribes or tells us that what is our main issue, we tend to take it as gospel truth. What's important is to figure out the underlying reasons why this has happened because you have not acquired this. It has been acquired overnight. None of us have been born with this. It only happens because of certain aspects until and unless we have been infected with something and it has caused severe damage. So the moment we start questioning our own selves, why is this medicine? Why do I need to take this medicine? What is the root cause of this? And we start, looking at it, trying to figure out what it is. We have the answers. Uh, you know, for each of us, the answers are different. For each of us, the solution is different because each of us have a different construct in terms both of our biological systems. And my understanding at the end of the day is that it all culminates to what I call it as, or what is normally known as metabolic disorders. And this metabolic disorders manifestation for each of us is different. So each of us, when we understand our metabolic disorders and how it manifests in us, then probably we should be able to figure out the right method or the right protocol or the right process, whatever you want to call it, in terms of reversing this disorder. And in that context, uh, I have been actually also engaged with many of my friends, my colleagues, my acquaintances who I have been talking to, and I have been also reaching out to them because they wanted help from me. What have you done to get this rid of all these things? So I also helped them in terms of, I would not say a guidance, but actually helping them to get answers for themselves.
Great. I think we have a lot of potential to bring about positive change in the health systems of the world. And you nailed it right, because today healthcare is seen as something that's just to give you a pill to manage your disease without going into the root cause. And this is why we created Ketospan to be one amongst the several other efforts that's going on in the world today in order to bring metabolic health to the forefront. So with this, we hope that your journey will be an inspiration to many others. And thank you, Dr. Datta, for joining and sharing your very inspiring story.
Thank you, Anish, and feel free to reach out if I can be of any value.
Thank you.